Welcome back. You're watching Coronavirus Facts versus Myths with me, Rishika Barwa. Let's get you the top story that we're tracking today, which is, of course, concerns around the Delta variant, even as India's cases continue to show a downward trend. Now, there have been 92,596 new cases in 24 hours, 2,200 deaths reported in this time period. The positivity rate in the country is now below 5% for a second day in a row. All of this is good news, positive indicators. But the Delta variant of COVID, also known as the B.1.617.2, is the dominant variant here in India. Now, we know it is rapidly transmissible, 50% more transmissible than the Alpha variant, and it's spread to 60 countries in the past months. The big question that many people are now trying to grapple with is whether this Delta variant of COVID is in fact more dangerous. So while the genomic study that was done in India says that at the moment we can't link more severe disease or deaths to the Delta variant, doctors are still figuring this out. In fact, some are saying that it could have now other allied problems linked with the Delta variant. Hearing impairment, severe gastric upsets, and even blood clots leading to gangrene are not symptoms that are typically seen in COVID patients, but have been linked to the Delta variant by some doctors in India. Let's open this up for discussion to our panel of expert doctors joining us. We have Dr. Ajay Swaroop, Chairman ENT Department from the Gangaram Hospital, and Dr. Abdul Ghafoor, Consultant Infectious Diseases, Apollo Hospitals, joining us from Chennai. Thank you very much, doctors, for sparing your time and being with us on NDTV. Dr. Ghafoor, if I can begin by asking you, in a recent article, you've been quoted as calling the Delta variant the new enemy. Why do you say this?
Rishika, the current variant that is spreading in the country and across the world is behaving in an entirely different from what we witnessed last year. If you look at that from a clinical perspective or epidemiological perspective, it behaves like a different virus than we witnessed last year. Family members are coming in groups, the severity is more, a tsunami of black fungus, clinical presentation is different. It looks like a different virus to me as a clinician and with somebody with some knowledge of virology.
Dr. Swaroop, would you agree? Because it's interesting that this is being said, given the fact that the genomic study of the Delta variant here in India has admitted to it being more transmissible, has admitted to it causing the second wave, but hasn't linked the Delta variant to more hospitalizations or more severe diseases and death.
No, I mean, it would be very premature to say that this variant is far more lethal or producing much more things. You see, it is more transmissible, so the absolute number is more. Once the absolute number of patients are more, naturally sick patients will be more, and our response to these sick patients is partly responsible for, well, at least as far as ENT is concerned, for increasing cases of mucormycosis. Now, other complications, etc., which are being mentioned associated with this are also partly a result of a vigorous treatment or a vigorous response to the disease, to the severe disease. We have used more immunomodulators, we have used more toxic drugs, and part of the blame should be on that also. Though, of course, at this stage, I am in no position to say that this virus per se is not causing these complications,
right,
but I think it is a little premature.
All right. So what you're saying is actually very interesting, because you're also saying that one doesn't know if this is actually a direct post-COVID related complication or whether it is actually a complication that is being caused because of excessive treatment or use of steroids, which is the case with mucormycosis. So that's an interesting assessment as well. But Dr. Abdul, if I can come back to you, these new symptoms that are now being talked about, which is severe gastric symptoms, this has also now been issued as a warning and added to the list of COVID symptoms. So if you have very severe gastric problems, you are being advised to get tested for COVID as well.
We used to see patients with diarrhea even the first wave. But the number of patients with this diarrhea presentation is definitely more this wave. And the number of black fungus, I want to come back to that point. I don't believe the tsunami of black fungus that witnessed today is because of the increased denominator. The peak number of cases that we had during the first wave is 1 lakh in the country, and second wave is 4 lakh. But the number of muco cases that we witnessed this wave is not 4 times more. It's not because of the number of cases. It's not because of the number of cases having diabetes. It's much more to it. If you look at the blood sugar pattern of this year, more than 50% of the COVID patients with mucormycosis are having high blood sugar, very high blood sugar.
Right.
We used steroid last year. The recovery trial, we supported the steroid, was published June last year when I was admitted and I was the COVID June. I remember the date when it was published. And we used steroid ever since then. We use the same steroid, the same dose, the same steroid, tocilizumab we use at that time, yes, definitely more. But tocilizumab is not really a risk factor for mucormycosis.
Could it also be attributed? Could it also be attributed to misuse? A lot of people who are borrowing prescriptions from neighbors, friends and family and administering steroids as a result of the fear of COVID and severe COVID, as was the case at the peak of the second wave? Dr. Abdul?
The steroid is an independent risk factor for development of mucosis.
Right.
Last week, we have got published data from India. Steroid is an independent risk factor. Oxygen use independent risk factor. Diabetes independent risk factor. But there is something more that we are not able to explain that looks like the behavior of the virus, because the Delta variant is producing higher blood sugar.
Interesting, because the UK study says it's being linked to more hospitalizations and it is more severe. In India so far, our study hasn't proven this. We haven't said it officially. The Genomic Consortium and the NCDC study has not linked it to severe disease, but you're saying that these are questions that we definitely need to ask. Dr. Swaroop, if I can come back to you, specifically talking about issues of hearing impairment. Now, we're hearing of this for the first time. Issues of swelling around the neck or even severe tonsillitis. Are you seeing this in patients?
Well, yes. Over the last maybe 5-7 days, I, with my practice at Gangaram Hospital, have unexpectedly seen 2 to 3 cases of comparatively young individuals who have recovered from COVID and after 2 to 3 weeks have come with complaints of significant hearing loss, and that is a neural hearing loss, which means that their nerves have been affected and they have a 40 to 45 decibel hearing loss, which is a little surprising. But again, let me tell you, coming back, I mean, just touching on the topic which was discussed 5 minutes ago, is that having all these complications or having mucormycosis is not just one factor of steroid or diabetes. It's a combination of many, many factors. And there are a lot of things which are going to come up as the studies keep on going, as the virologists study more and more into details. So at this stage, I feel, yes, we are getting little bizarre symptoms. Really, in the first phase, diarrhea, etc., was not considered anything. Now,
Dr. Swaroop, can I just very quickly ask you, these patients who've reported either severe tonsillitis or hearing impairment that you're saying you've seen in just the span of the last week, how severe was their COVID? Can you link it with a more severe COVID where they were administered steroids or were, in hospital, or is it also being linked with patients who had a relatively mild or asymptomatic infection?
Well, I don't have that big a study to comment, but majority out of these 4 to 5 patients, the most surprising part is that all of them are comparatively young, which means the age group of 40 to 50. Okay. All of them have had COVID, at least moderate, if not severe, and they have been in the hospital for some time.
All right. So you're saying that moderate to severe disease, and also that you're seeing this in a relatively younger age group, 40 to 50. Very interesting. We're of course going to keep a close watch. A lot is still being studied and known about the Delta variant, a lot still in the realm of the unknown. Thank you, doctors, very much for joining us. Dr. Swaroop will, of course, continue to stay on with us and join us back in just a bit. But let me just shift our focus to how is the world looking and dealing with the Delta variant. In the UK, for instance, reports now suggest that a daily COVID cases have risen by 90% in a biggest week-on-week jump since before Christmas. This is being linked to the rapidly spreading Delta variant. This is forcing the UK, for instance, to reconsider whether or not it's going to lift its lockdown later this month. The Delta variant is likely to be the dominant variant in the United States by the end of July or even earlier, say some experts. The big question, therefore, is do vaccines work? And given that this rapidly transmissible variant is around, should different countries, especially like India, should we be looking at unlock? We have with us Dr. Eric Fiegelden. He's an epidemiologist and health economist. Thanks for being with us. I want to begin by asking you about the more rapidly spreading Delta variant, 50% more transmissible, spike in infections in the UK being linked to it. Should countries like the UK, which is mulling a complete opening up, and countries like India, which are gradually lifting lockdowns, should we be actually doing that?
I think India has to be very careful because the Delta variant we've seen from the data, it is not only more transmissible, 50% more transmissible than the UK Alpha variant, but UK Alpha variant is also very more transmissible. So it's actually 2 times more transmissible. But it also causes more severe disease and hospitalization. It increased hospitalization about 2.5-fold compared to the UK variant, which compared to the Wuhan variant means it's about 4 times greater risk of hospitalization. So you have to be very careful in India of looking at a regional basis. Are hospital capacity adequate if you slowly drop restrictions? Are testing rates going down, or are cases truly going down? Are positivity dropping? Because you want to make sure cases are dropping for real, not just testing related cases, and that we have enough hospital capacity in event we have another surge. So you have to make sure you have all these security and precautions in place before you remove restrictions.
Right. I want to also ask you another question that's really puzzling a lot of people. Why is the Delta variant being touted as more dangerous? Is it because the variant per se has properties which could cause severe disease? Or are we saying that this is a dangerous variant because of the fact that we know it's more infectious, it can infect more number of people in a shorter span of time, leading to a burden on the healthcare infrastructure?
The answer is both. It's the worst of both worlds. It is more transmissible, which increases and balloons the number of people infected, increases denominator, and therefore increases the number of people hospital. But also, on a per case basis, it has a higher risk of hospitalization than compared to other variants. This is why it's a double whammy. It's 2 times more contagious than the original Wuhan strain and 4 times greater risk of hospital admission than the Wuhan strain. And so hence, it's even worse than the Alpha variant as well. It is both more transmissible, which balloons the number of cases, as well as by itself more severe. This is why it's the worst of both worlds in terms of these properties, and that's why the Delta variant, I believe, is the most troubling strain variant we've seen to date.
Right. Well, the other cause of concern, of course, is vaccine efficacy. And as far as India is concerned, I think the bigger question, especially after the Lancet paper, is whether we need to relook at our dosing regimen. India is at a 12 to 16 week for the AstraZeneca vaccine. The UK still, for its younger population, is going with the 12-week gap. Does that need to be reconsidered?
Yeah, I think originally with the original strain, 2 doses separated out was okay because the first dose gave you a decent partial protection. But with the new Delta variant, 1 dose just is not enough. We really, really need to up it to 2 doses as soon as possible for everyone. So the 1-dose strategy was a strategy for a different era of the pandemic. I think in this new era of the pandemic with the Delta variant spreading around the world and quickly becoming dominant in almost every country, dominant in the UK and rising quickly in the US, I think 2-dose must be the main objective. No 1-dose shortcuts.
You're also saying that it is the fastest spreading in the United States, and there are studies that show that it's now going to be the dominant variant even in the US by July or even earlier. How is the United States looking at these developments?
Well, US, we're looking at the models, and we're also seeing what also previously happened in the UK. In the UK, remember, previously dominated by the previously fast B117 alpha variant, that has been completely replaced. We're at basically 80% Delta variant now in the UK. The old alpha variant's almost gone. And in the US, we can see Delta variants completely surging and becoming by far the fastest growing variant as well. And that's why the projections show that by July, it will likely become a dominant in the United States, across the US and most of the states as well. And that is very, very troubling because, you know, a lot of US does have a lot of vaccines, but a lot of US actually does not have enough vaccinations, especially 2-dose vaccinations in the rural South and conservative areas.
Very important point that you make, Dr. Fiegeldin, that both doses of the vaccine are in fact imperative for a better chance of protection against the Delta variant. Thanks so much for joining us on NDTV. Short break here. On the other side, we'll answer all your questions on the COVID vaccine. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing any questions you may have about the COVID-19 vaccines. We often take to Google to find such answers, but we have an expert doctor to answer some of those questions today. Dr. Ajay Swaroop, Chairman, ENT Department, Sri Gangaram Hospital, is with us. Thanks, Dr. Swaroop, for being with us. One of the most commonly Googled questions is about COVID prevention. How can you prevent yourself from getting COVID-19?
Well, I think the fundamentals remain the same from day one. And prevention involves masking, and a reasonable distance, social distancing. Avoid closed spaces, avoid large groups, avoid large gatherings. Keep your personal hygiene to the highest level. That I personally believe is still the fundamental way to prevent COVID. There is unfortunately a lot of medical treatment has been tried from the day one and has been given up. And now, as far as I'm concerned, there is no medical way you can prevent. It is just take precautions, be careful, that's it.
Right. You know, the other question that a lot of viewers actually have is about, of course, wearing your mask, maintaining social distancing, hand hygiene are the cardinal rules. But what about, you know, the consumption of multivitamins or, you know, vitamin C? Does this actually help in building your immunity to COVID?
Well, if it builds your immunity, it will work for any of the diseases. So maybe COVID also, why not? But I will not say that specifically having vitamin C or having zinc or having multivitamins build your immunity for COVID. It is per se building up your immunity, so you will be a little more in a better position to fight COVID also, like any other disease for that matter.
Right. So it is important to, of course, you know, build your immunity as well so that you can fight the disease. The other question that a lot of people have is about self-care during COVID. You know, a lot of people we know get a mild infection and treat themselves and get better at home. What are some of the cardinal rules when it comes to self-care during COVID?
Well, self-care now, of course, is one of the very major mode of treatment or mode of control of this disease. And majority of patients who have very mild symptoms, self-care is the answer. And as far as self-care is concerned, there are clear-cut guidelines. One, of course, is that you should prevent the spread of infection to other people, to other members of the family, which means you must have a separate, well-aerated, well-ventilated room, preferably with an attached bath, the house, so that rest of the family members are kept as far away or as protected from you. That is point number one. Now, as far as your own personal care is concerned, we must have a regular measurement of oxygen. We must have a thermometer, regular measurement of temperature. It should be a well-ventilated area. Diet must be adequate and healthy. Must avoid, alcohol or some other such stimulants.
Right.
And rest, of course, you should be in constant contact with your physician. There's no question of self-medication or self-care is all right, but medication is a big no-no. Even taking paracetamol, I personally feel every patient should be in contact with his or her physician and take appropriate medicine only on medical advice.
Well, I think that is very crucial advice. When you're talking about self-care, taking care of yourself is very different from self-medicating. And the medicines is something that you should take only under medical advisement from your doctor who's treating you for COVID. Thank you so much, Dr. Swaroop, for sparing the time and being with us on NDTV.
Thank you.